Thanks for staying tuned. Well, let's delve straight into it. Now on paper, there's movement, increased budgetary commitments, recruitment drives targeting thousands of health workers, upgrades of facilities across senatorial districts, and renewed attention to health insurance and primary care. But on the ground, the stories are more complex. We're still seeing communities where health centers are locked during emergencies, where women in labor travel miles only to meet empty facilities, and where preventable deaths continue to raise tough questions about access, accountability, and system efficiency. At the same time, we're seeing interesting shifts, like the push to integrate mental health into mainstream healthcare, new insurance models that include people living with HIV, and regional conversations around building specialized facilities to reduce medical terrorism. But we still do not know what's working and what isn't. Some critics might even argue that nothing at all is working in the health sector of the country. So the next question would be, where do we go from here, especially in a time of economic pressure and shifting global health funding? To help us appraise these, we're joined by someone who has been at the center of health interventions across Nigeria, and specifically the Niger Delta region, particularly in HIV/AIDS response, health system strengthening, and community-based care. Talking about CEO of the Excellence Community Education Welfare, ECEWS, Dr. Andy Ayo. You're welcome on the program. Thank you for joining us.
Thank you so much, Steve.
Thank you for joining us, Doctor.
Thank you so much.
It's a pleasure.
Let us start from the human side of the conversation. We hear big numbers, billions committed to health, welfare, talking about the Niger Delta region of Nigeria as a whole. But then it will still seem as though we haven't got it right in the health sector, because you hear of real complaints from care for pregnant women, the elderly, primary healthcare systems still very, very much underdeveloped. And the other day I was speaking to a friend that stays outside, and he was likening our most sophisticated health facility to just a glorified healthcare center, a primary healthcare center outside. When you look at all of this, does it make you cringe regarding the situation of healthcare in not just the Niger Delta region, but across the country? And how do we begin to start getting it right, efficiently in the health sector?
Yeah, thanks, Xavier. I mean, you're very smart. I think you got it all wrapped up really smartly. I mean, having been a practitioner in the sector over the past 25 years, I think it's one of the things we must take into cognizance. Nigeria is now seen as a low to middle income earning country. You would be making comparisons with the UK, the national health the system there is pretty really organized. And remember, it's a high income earning country compared to Nigeria. We know where we're coming from. I think one of the things we really need to look out for is where were we 20 years ago, 10 years ago, and where are we now? What kinds of resources are required? Nigerian healthcare system, I would say the HIV and AIDS response has been a big trigger for strengthening the healthcare systems in the context, and driven quite, not just HIV and AIDS, but donor systems. You're looking at maternal child newborn health, looking at, immunization, looking at infectious diseases as a whole. There's been tremendous investment, but with a system that was not really primarily in place. And I want to be clear on that. Like sort of from infancy, you could see, yes, a lot of money is being invested, but it's taking time for it to silt down to the communities. We still have a huge amount of women who attend to unskilled birth. I mean, that only came up in recent time, where you're getting maybe about, say 50% of women now attending skilled birth, which is really also one major challenge where we're having very high maternal mortality in Nigeria as a whole. I mean, we have one of the highest rates globally. And I mean, that also includes the Niger Delta. But so we think, I must congratulate His Excellency the President for bringing in the Minister, Professor Patti, who's also been somebody at the middle of all of this in terms of understanding the healthcare systems, both at the global level and at the country level. So we would see the swap mechanism where they're trying to actually harmonize resources, reduce duplications, and try to harness those funds to, achieving more with less. We also see that in our state here in Akwa Ibom with the Honorable Commissioner for Health, Dr. Kim John. I think we must also really congratulate His Excellency the Governor, our dear Governor, Pastor Mobasi, PhD, for his intellect in pulling the right people and putting them right. Like someone like Dr. Kim John, who's pretty young, smart, innovative, and trying to really break stereotypes, because that's also where we need to be in terms of pushing the limits on the healthcare system. So I appreciate what he said. I mean, recently the state did commit about almost 700 billion to emergency response for the state in terms of trying to jump, and we can see that one major area that is a big problem also. I mean, beyond infrastructure, human resources for health is a major concern. I mean, as an organization, we're supporting the government or the state government in various states, and we're seeing that we're losing doctors, pharmacists, nurses, laboratory scientists to the developed world, and the challenge is, how do we keep them? How do we remunerate them better? I think part of the emergency response makes healthcare, a doctor in Akwa Ibom, for instance, and a bit better than doctors in other states. So you would say, but that's something we need to intensify. So our health insurance package needs to go very far. We have about 20 million Nigerians now, according to data on health insurance. In Akwa Ibom, I think we're hitting off close to 175,000, which is still not so high, but quite a lot better than it was. And remember, the healthcare insurance system was just set up about over 2 years ago. And so they've screeched in terms of providing care, but domestic resourcing remains a major thing. So yes, you could see billions, but I tell you what, if you convert those to USD, you would find out that it's not quite a lot of money. And so much money is required. A lot of what we use within the healthcare sector is important. All right, so you see the global economy, the Nigerian economy, the purchasing power parity of people affects what we can do. And then the whole context of free healthcare is also a real challenge. This is why I'm very happy that as a country, we're really pushing on with health insurance. And as a state, within the Niger Delta, we're also really pushing. I mean, we support Delta State is doing quite well with their health insurance. Bielsa did try quite a lot, so we could see a lot of good projects, or rather programs that are trying to push. I mean, in Bielsa at the time, we had most of the women attending skilled births, and our PMC program was riding well, because when that happens, it reduces maternal mortality, it reduces infant mortality. And so you can see that these strategic investments has to continue. Now, the consistency of it and the release of it is vital.
All right, Doctor, let's take it down to this funding aspect of it. You said a lot of money has been pushed into the sector, like the one recently, signed by the governor. But is it actually enough? And you said it's not actually enough, but at what level, how do we prioritize, to ensure that we can actually achieve a lot with the little that we have? Because obviously it's like we don't have enough.
Yeah, we will look at Akwa Ibom GDP. I think somewhere around 19.5 billion, US dollars. And as a country, we're just looking at Nigeria is aiming, according to IMF, to go up to about 334 million US dollars, which, I mean, the president has a tall, great plan to move the country to about $1 trillion economy, I think by 2030 or thereabouts. If you look at those resources, possibly with the aim, the tax to GDP ratio, because we must, and that's why I'm really happy that the president's come up with a new tax law, which allows maybe the rich to pay a little more, isn't it? If that's really happening, then the monies are being prioritized. Just coming back to your word, prioritization of resources, which has to be, how do we get that needs assessment? I think, talking with the Commissioner for Health, that's one of his primary objects, doing a comprehensive needs assessment across all primary healthcare, secondary healthcare facilities to understand their basic need. And the needs are enormous. You would say very clearly, going back to your word, sometimes, a ward is made up of several villages. And sometimes in a whole village, you don't have a primary healthcare center. We also need to be innovative. I mean, through our programs, for instance, we've been able to, triangulate with the, bed attendants, the traditional bed attendants, who really are that interface that attempt to bridge that gap. So when a woman is pregnant, but how do we strengthen that system in terms of, and I think the government is trying to do a bit of that, because we don't have enough help. We have shortage of healthcare workers. We have infrastructure deficit, isn't it? In terms of, and even when we have the infrastructure, there are issues around equipment, medical equipment. We have all of it. But I must also congratulate the government, like I said, through that medical emergency plan. I think renovation of several secondary health facilities, there were 16 of them. But again, we have so many that need the service, isn't it? We need to really, really go right down to the community level, because at the community level, that's where you really get the need. You know, the people at the community really are the ones that need it. And then what is their purchasing power parity? So it comes back to the social safety net that we must begin to provide through the Basic Healthcare Provision Fund or through the Acquirable Insurance Act, which allows the government to vote some resources. And I think recently, I think the governor did provide for junior workers, all right, full insurance for them. Because once we can resource the facilities, the hospitals through insurance, what happens, more monies become available, they can buy more medication, they can hire more medical personnel. And we're seeing that where we're supporting in River State, working with Renaissance, we're supporting Akuku Toro healthcare facility at Bonima. And we're seeing that, look, it's working. Over 800 guys have accessed services out of the over 2,000 that we've brought in onto the healthcare insurance. A lot of them paid by Shell, and about 500 of them were paid by individuals within the community who have resources, who say, okay, I want to put 100 people, I want to put 10, I want to put 2. And it wasn't a lot of money, like the 20,000. But I also think, even looking at that, and then coming back to resourcing, because again, this is a source of real worry. Even while we're trying to fix what is existing, we're saying, what is the appropriate amount of money that should be paid as premium for health insurance to make it realistic to serve at quality? And we're seeing that the actual studies looking at 30 to 40,000. So in basic health funds are about 12,000. Even we are operating at about 20. So we're saying all of this, we still need to prioritize more resources. So when we're saying we're providing free healthcare for pregnant women, we're ensuring that we actually put all of them on health insurance, which I think the governor is also committed to.
All right, Dr. Ayo, we're going to come back to health insurance,
Yeah.
but then let me get you to appraise the exorbitant cost of getting drugs recently. We've seen that antibiotics that you could hitherto before now get at 4,700 naira is now selling at over 30,000 naira, and you begin to wonder what happened. What is it with that sudden jump? And you begin to wonder persons who were dependent on drugs of that nature. I don't want to mention the name because of obvious reasons, but we've seen these realities in our society and in Nigeria, and it is causing a real issue for persons who depend on these drugs to survive, persons who do not even have enough to cater for themselves. Talk more of catering for getting drugs of that amount. How did it get here? And is there anything we can do from this point onward?
I think you're spot on this. I mean, when we really go down to reality, these are the issues in out-of-pocket payment. That's why somebody sees us drift to health insurance. But the reality is that drug manufacturing is a global issue. You know, it depends on the global economy. So, I mean, today you see, because of the U.S.-Iran war, U.S.-Israel-Iran war, you see the oil price of fuel go up, isn't it? And that also drives up the cost of materials and things that we have with drug production. That's why I think we must also support the minister with what he's trying to do with getting more manufacturing done in country.
How much of what we're seeing now can be blamed on relocations that we've heard of these multinationals who are involved?
Yeah, absolutely, because we have to create those conditions again. Remember, power is a major concern. I mean, most of the businesses in this country are stifled because of power, isn't it? Access to power and, the pay for power. Recently, we know even the teaching hospitals, most of their revenue went to pay for power. So companies want to make margins, isn't it? And if they're going to spend so much on power, then they're going to be drifted and they're going to leave. And that has happened not just in the healthcare sector, but I think across all the sectors. So this is a major concern. And so most of the drugs, antibiotics you're talking about, are manufactured outside of Nigeria, in India, across the world, and they're shipped down to Nigeria. And so the cost of shipping them down, the whole process, I know even, medics have quite some leverage in terms of custom duties, but even at that, this cost is far-fleeing. I remember with the deregulation of the Naira recently, so the cost margin in terms of the dollar to Naira, that has drifted, moving from like 400, 700 to now about 1,000. One thing we can also celebrate is that there's been consistency over the last 1 year. Over the last one, you've seen it around 1,500 to $1. These factors control how pricing occurs. And these factors also control what happens to that woman in the village.
All right, Doctor.
Depends on antibiotics. Okay,
we're going to take a break, but when we return, we're going to get down to the nitty-gritty of insurance and how it can be impactful to persons living in the Niger Delta, and how we can even do it much better than we are having it right now. Then also talk about interventions in HIV/AIDS, the recent withdrawal of support. We can talk about the drugs and all of that. how it is currently and whatever updates that there are available currently that people should know. So this station, Niger Delta, continues right after this brother.
A new dawn of unprecedented development has emerged in Akwa Ibom, driven by the Arise agenda and led by the people-centered administration of Governor Umoeno. An agricultural revolution has unfolded through Ibom model farms, farmer support initiatives, and food security programs. Roads and bridges are reconnecting communities, driving inclusive growth as power sector reforms advance and CNG mass transit gets set to deliver cleaner, affordable transportation. Maritime infrastructure is rising in Oron, reviving coastal commerce and transportation. Security is strengthened through modern technology, vigilant security agencies, and the Ibom Community Watch. Housing and investment are accelerating with free housing for workers and homes for the vulnerable, and landmark estates repositioning the state. Education is redefined with model schools, while healthcare expands with model centers, and the 350-bed Ibom International Hospital health insurance coverage is progressing steadily with hundreds of thousands of enrollees. Tourism is advancing boldly with the audacious Arise Palm Resort, Ibom Convention Center, Arise Shopping City, and a growing aviation ecosystem. Governance, procurement, and recruitment are smarter through digital innovation. Because the people matter, workers, women, youths, retirees, the elderly, and the vulnerable are empowered across all 31 local government areas. Akwa Ibom, steadily progressing under the Arise agenda of Governor Umoeno.
Thanks for staying tuned. We're still discussing health interventions in the Niger Delta region and across Nigeria, and we've been having this conversation with the CEO of ECEWS, Dr. Andy Ayo. Well, thank you for coming on this particular interview. We appreciate your time, and we're already with the insights you're giving us. I'm sure we'll be able to milk some more from you. Let's talk about insurance and the fact that there are still persons living in the Niger Delta who are assessing these schemes still feel very distant. They do not know how to go about it, and even when they decide to, they still complain about that it's expensive. So let's talk about how we can truly make insurance inclusive and more accessible to persons who indeed need it, because everybody needs it.
I agree with you completely. I think the informal sector, I must thank His Excellency who put me on the board for the health insurance last year. And I think in Akwa Ibom, and it was pretty good when we could see that from not having so much, less than 50,000, they've grown out to 173, 174,000 on insurance. And that, how has that happened? I think it's a lot of multi-sectoral approach and really increasing informal sector, not just the formal sector. The formal sector just a small pocket. The women in the market, that mobilization, getting people to even be aware that there is insurance. I had somebody in my office yesterday who had gone through the insurance and they didn't know that maybe the wife also should have been on the insurance. So people might even think, okay, they don't know much about that awareness. The awareness. So first, we need to let people know more at the community level the cost of it. And you could actually make this through very simple mechanisms. What we're trying to do in these areas, in River State, for instance, we're trying to say, look, if it's 20,000, so it means you can put away 2,000 to 3,000 a month. And if you put that away, tuck it away in tiny bits, and that's more than going to buy drugs or going to have a cesarean section all the way, which is really expensive, isn't it? Because the whole concept of health insurance is that bulk context, isn't it? And then you could solve some people's problems while others are not coming for it at that time. And I think we need to deepen it. Like now, the penetration in Nigeria is about less than 10%, isn't it? So that's pretty not as good as it should be. I think we need to get more people to have confidence some people don't feel that confident, isn't it? I mean, they feel, oh,
Maybe
the
Nigerian factor might still play in.
Exactly. So when they say it's expensive, it means that's not even insurance, isn't it? Because if you're insured, you're not paying no money. You're just walking into the facility, getting cared for, and you sign some papers and walk away free and feeling good. I mean, that's the easiest way I always tell people is like having your wife go to deliver. I mean, after delivery, she just signs a few papers and they wish you well. That is the beauty of insurance.
And discouraging out-of-pocket pay.
And because out-of-pocket, you never can have so much money per time. And globally, it's the practice of insurance. It has to penetrate. That's why as an organization, we've invested resources. We put a lot of our staff, for instance, we have about 1,600 staff within the state who are on the lower cadre a little, and we put them all on the health insurance. We paid all the premium. We've paid that for 2 years now, about 18,000 times 1,600 of them. And, you know, because we believe in what is happening in Akwa Ibom. And what we've done in Lagos State, we've also coordinated the same approaches in Cross River, in Delta. You know, we're trying to put a lot of our HIV positive persons on health insurance, you know, and we're saying, look, it's not sustainable that people pay for it. You know, market women can actually hatch some little amount of money, isn't it? Through the market mechanism, they can put together 2,000. You know, they do the SUSU system, isn't it? I mean, anybody doing something, a mechanic can begin to say, oh, I know that my wife is going to put to bed in 9 months. You don't start planning then. You start putting away little resources. And then when it's time, what happens? You just go to the hospital, have access to healthcare. It is not yet everywhere the way it ought to be. And let's be clear. I mean, not all facilities may be providing the service, but it's progressing. And I think the media also has a responsibility. We, within the community health space, we have a responsibility to push and let people see the need to get themselves into that bucket that allows them access. Because universal health coverage will never happen until we can get as many of our people on health insurance. And also, we also deal with the supply end. What health insurance does is, I mean, we're having nurses fleecing, moving all over, isn't it, trying to get out of the country. If we're able to pay them well, we come up with a better remuneration scale that works for doctors, for nurses, you're going to keep them around.
All right, doctor, you know, talking about health insurance, some people are like, why force me to access this healthcare? They're actually concerned about the quality of service there. Yes. How qualitative is this service delivered in these healthcare facilities?
I think to the best extent possible that the state can afford. I wouldn't stand shorty for that, but I would say if you get health insurance, and first, at the social health insurance space, the primary healthcare centers are there. You know, there are doctors, there are nurses, there are people that are providing some work, isn't it? So you access the services. There may not be doctors everywhere, make no mistake. Some of them have nurses, isn't it? But they also have mechanisms. What we've also tried to do, for instance, in order to strengthen the healthcare, is digitalization of the space. We provided about 132 all-in-one computers across Akwa Ibom State area. We've provided over 50 hospitals here with solarization. We've solarized about 50 hospitals in Akwa Ibom. I mean, in Lagos, we're currently installing 100 kVA solar infrastructure to ensure that the laboratory, the PCR lab there, is completely off-grid. And it is still thanks to the United States government. And you said something, the monies are drifting. And I like the way you put it out. The monies are not coming as much. So domestic resource mobilization is key. The government needs to start investing monies. And there's been an MOU signed between the United States government and the government of Nigeria, which allows the government to invest about $3 billion over the next 5 years, while the US government invests, I think, about $2 billion. And the government needs to start progressively, and it's not just the federal government, the state governments have their own 40 in this, where they have to begin to put together. Yes, counterpart. Like, they need to pull that money to the table so that the people will be the beneficiary for it. It's the people that we're thinking. So that agreement, I think, will strengthen domestic resource mobilization. The government of Nigeria has signed it up. I think the state governments equally will be committed to it. Akwa Ibom happens to be quite one of those very important states in our country. I mean, just looking with the GDP currently is almost about the third richest state as proposed in Nigeria. So, I mean, we're doing quite a lot, and I think we're at the forefront of trying to fit into that. And that's why I must thank His Excellency for putting out about 695 billion naira to supporting work within the emergency response, and trying to get more hospitals in place, like the 350 hospital, and also employing about 3,000 guys. That is important, because without the people, there are no services. Without the skilled labor, no services can occur. Without the products, no services can occur.
All right, let's get down to the HIV/AIDS care for persons or patients living with the virus, and the recent events that happened and where we are currently. What is it like being a person living with HIV/AIDS currently in the country? The interventions, the care, are we still having it come in, or are those regulations and suspensions still in force?
Yeah, I mean, we must also be grateful to the United States government. I mean, despite that stop work order that came sometime last year, about February, it was just very short-lived. I think it was about roughly 2 weeks or so. And because of the fact that, HIV and AIDS itself is not curable, I think there was a limited waiver that allowed life-saving drugs to continue. And I think that's something, and while I'm not holding forth for the U.S. government in that country, but that's what's happened. So till date, that, resources, the people living with HIV have continued to receive their medications unabated. The services, the quality is continued. However, that is why this MOU is very strategic. And the MOU is not only for HIV and AIDS, it's an integrated MOU. It's covering all of that sickness, illnesses, infectious diseases, TB, malaria, and other areas, maternal, child, newborn health. So basically, it's saying, look, we are giving it now, but we are saying 2030 is a deadline. So
that's a deadline.
Absolutely means that you have to start stepping up, taking over. So the government from now needs to start putting their best foot forward, taking over. So by 2030, it's estimated that Nigeria will fully be responsible for the healthcare services of the
Was there perceived lagging behind? Was there perceived lagging on the part of the Nigerian government, and that is why this timeline needed to be set?
Well, not necessarily perceived lagging. As you know, healthcare is expensive, and we just talked about the cost of providing these services. I mean, billions of dollars get spent in Nigeria supporting healthcare through various donors, including the U.S. government and others. And so Nigeria itself needs to start making more money. That's why we're happy with the fact that when the economy hits up on $1 trillion economy, moving fully into a middle income or high to middle income country, then she can afford more of our services, and then the social safety net will improve. And then our people, our own people, in your village, in my village, that woman, that pregnant woman who is about to deliver in 2 months will be the better for it.
Well, a lot of people would want to say, if these projections are measurable on the long run, but then we would hope to see that it actually plays out the way that we're projecting it. But the positives are actually what we're looking out for play out. But then let's cap it up with what ECEWS is doing, the interventions so far in the Niger Delta region, and possibly what the role of partnerships are in bolstering the health sector in not just the Niger Delta region, but countrywide. Do you think that the government also needs support from private institutions like yourself?
So basically, the issue of healthcare is is everybody's responsibility. And just to let you know, ECEWS actually supports services in all of the South, South, East, Southwest, and not Central. So a couple of the states here, we have offices across the country. We're supporting Lagos State with their HIV intervention. We're supporting currently over 300,000 people living with HIV across the country, and I think about 132,000 in Akwa Ibom. Our services are very jolted, and not only that, in malaria, in tuberculosis, in non-infectious diseases. So it's broad-based, but one thing I think we're holding dear is the health system strengthening approach, where we're able to say, can we strengthen service delivery? Can we build the capacity of this healthcare worker to provide integrated healthcare service delivery across board, beyond HIV, going to malaria, going to tuberculosis, maternal, child, newborn health? Can we provide alternative power? I do remember a facility, Okobo here, Okobodi in Okobo, where we went to. The 10 kVA solar infrastructure that we provided there is the only energy resource that they have, and they don't need the grid. They're off grid, and they're doing very well. The women are delivering. And so, the government cannot do it by themselves. We invest some resources, and we work with several donors, mobilizing resources to help our people in Akwa Ibom, in Cross River, in Rivers, just across the Niger Delta, across the South, and across the country. And the place of the development worker can never be taken off. Development partners are often important. I mean, from Bill and Melinda Gates, MasterCard Foundation, all of these guys are great institutions that we can all leverage. And that's why we continue to commit to supporting our work in Nigeria, supporting our work particularly in Akwa Ibom, which is like home for us. And we must congratulate His Excellency the Governor for his strides in healthcare. There's a lot more that still needs to be done, so much more that needs to be done. The rural woman in the village is cringing. We need to get that service to them at quality. We need to bring in more doctors. The truth be told, healthcare work cannot happen without the healthcare workers. We need to bring in skill. Now we're losing a lot of our people. It means we must innovate more. How do we retain the doctors? How do we train more doctors? Do we need a medical university in Akwa Ibom? Maybe we do. We're getting more universities now offering medicine and surgery. We need to have that happen. We need to really begin to plan, scale what happens in 2035, what happens in 2030. What kinds of AI integration are we going to bring into our work? How do we leverage on telemedicine? That's something we're trying to also promote by, what we're doing in Akwa Ibom. We're getting taps, we're getting doctors to talk with nurses at rural level, through our ECEWS, just to build the capacity. Because again, nobody in the world, even the United States, do not have enough doctors.
So does traditional, medicine have a role to play in this process of growth?
Fantastic. Traditional medicine has to be scaled. I was in China last year towards the end, and I could see tremendous development in traditional medicine. And that a lot of, and I think in Nigeria we're really doing well trying to harness them. But again, there has to be a different posture from our government systems, looking at them as supportive and trying to actually also, there's a lot of quackery in that sector because it's unregulated. So we have to actually look at how do we organize them, how do we invest more in R&D research to make sense of what really can these leaves solve, isn't it? The truth is that we're not investing enough. So our pharmaceutical library, for instance, and several universities need to invest resources. NIMA, in how do we understand how to locally resource? I mean, COVID has come to teach us a lesson. You can't depend always on the world.
Well, Doctor, we have just less than a minute to go, and I'd like to take your parting shot now. You just dropped a bomb that even the United States is short of doctors and still needs more, and which is why even in the Niger Delta region across the country, you still see people wanting to leave. The brain drain continues. Now, what are those specific things that we must begin to do immediately towards fixing the health sector in the country and ensuring that we retain our doctors here?
The value system must change. We must begin to value the people that we have, and we must begin to invest in the people and make them feel part of the solution. The doctors must be valued. They must be given proper places to live, proper places to work in, all right, and then remunerated better and valued. And value is key. Until you value people, you can't keep them.
The CEO, Excellence Community Education Welfare Scheme, ECEWS, Dr. Andy Ayo. We appreciate your time and company on the program.
Thank you so much.
Thank you for coming.
Thank you, Xavier. Appreciate it.
Thank you
for coming. It's been an interesting session.
I appreciate you as well. Thank you so much.
Well, that's it on the program this afternoon. Thank you very much for watching. Join us again tomorrow for another fresh edition. The name is Xavier Robert. Wishing you a terrific afternoon.
And I am Sifonode. Good afternoon.